Last Friday, the Philippine Statistics Authority released its report on the total number of deaths that occurred in the Philippines in 2021. In the 12 months of the second year of the pandemic, a total of 879,429 deaths were recorded. In contrast, the total for the year before, 2020, the start of the pandemic, was 613,936 deaths. The increase is staggering. The number of deaths in 2021 was over 40% higher than the total in 2020. 250,000 more people died. Did they all die of COVID? Good evening. I'm John Nery and you are in the public square. The data from the PSA is clear. Ischemic heart diseases remained the number one cause of death in the country, claiming 155,775 lives in 2021. The year before, ischemic heart diseases claimed 105,281 lives, meaning the number of deaths from this cause rose by almost 50% or 50,000. Was there a second silent pandemic happening at the same time as the coronavirus pandemic? On the country's pandemic response, Dr. Tony Leachon has been a constant source of both counsel and criticism. The former president of the Philippine College of Physicians even served as an advisor to the Interagency Task Force, or IATF, until a public breakup. A specialist in internal medicine and cardiology, he has also consistently warned the public against the rise in the number of cardiovascular diseases and deaths. He joins us tonight from the Manila Doctors Hospital. Good evening, Doc Tony, and thank you for joining us in the public square.
Thank you, John, for this particular interview, and I think it's about time that we discuss this after, of course, the control of the COVID pandemic and the silent epidemic that we have, what we call the lifestyle diseases or the non-communicable diseases.
Let's get the basics out of the way, Doc Tony. First of all, what are ischemic heart diseases?
Ischemic heart disease is basically the term for coronary artery diseases.
Okay.
It's basically meaning to say decreased blood flow to the heart. That's why they call it ischemia.
Okay.
But the anatomical definition is coronary artery disease. And mainly, ischemic heart disease or coronary artery disease is the number one killer in the world as well as in the Philippines, basically because of smoking, alcohol intake, unhealthy diet, overweight and obesity, and lack of mobility or exercise. So basically, those are the main causes of ischemic heart disease in the world as well as in the Philippines. But in the Philippine situation, we have a different problem. We thought with the syntax law of 2012, with the reduction in the smoking prevalence, we thought that the heart disease would also go down. But in the contrary, the heart disease has been catapulted to number one when it used to be number two in the last few years, second only to hypertensive cases causing stroke. And I have some explanation for this, but basically it's a surprise to all that heart diseases are the number one killer in the country today in the last 2 years.
Dr. Tony, actually the timetable goes a little further back, no? Maybe in the last decade. But first, another basic question. Heart disease is non-communicable, no? It's not infectious. Therefore, strictly speaking, we cannot apply the terms pandemic or epidemic to it because it is not infectious. So when we use the term silent or second epidemic, we are using it loosely as a figure of speech, no? To mean a public health emergency. Is there in fact a silent or second public health emergency involving itong lifestyle diseases?
Well, it's like this. About a decade ago, I retired from the corporate world and focused on practice, but I volunteered as a 1 peso consultant to then Health Secretary Enrique Ona.
Okay.
And I was appointed as a consultant on non-communicable diseases. So based on the World Health Organization, it is defined as diseases mainly due to ischemic heart disease, stroke, cancer, and chronic obstructive lung disease, and then of course diabetes. When we mean communicable diseases, ito yung nakakahawa. Basically, ito yung HIV, pneumonia, tuberculosis, and other viral illnesses or bacteria. Pandemic usually would involve the whole world, and this is the second time, 100 years ago, when we had this global pandemic, yung Spanish flu influenza. So we had some semi-pandemic, but it's not of this magnitude.
That's right.
So itong non-communicable disease, so for the last, I think, 30 years, meron na tayong ganito because of the high smoking prevalence in the country, mga 30 million na naninigarilyo. But because of the effect on the sin tax law where the prices of tobacco and alcohol tinaas, so that you can actually reduce the burden of the non-communicable diseases. At the same time, the money that you will get or generated will be given to PhilHealth. So basically, that's the health goal as well as the fiscal objectives. Natamo naman yan. Basically, bumaba yung burden but still number one. And then number two, yung fiscal objectives. Ang discovery ko, kaya nangyari to, nagkaroon kasi ng tremendous rise in overweight and obesity in the country. Plus yung diabetes, hindi naman siya number 4 dati. So, I think ito yung nakadagdag on top of a person na nag-smoke or alcohol drinking. Pero hindi naman common ang smoking and alcohol among women. Predominantly is a male dominated disease kung iisipin mo. But ang nakadagdag is what we call another term, metabolic syndrome. So it is a condition whereby nag-increase ka ng body weight where your blood sugar will be increased, cholesterol will increase, blood pressure will increase. And this will lead to either stroke or heart attack. Together with other problems like gallbladder disease and fatty liver, which would lead to cancer of the liver. And sometimes, because of the increase in the body weight, nagkaroon ka ng arthritis and then some problems in breathing, yung sleep apnea. In the 1980s, tinetrace ko to. I was a medical student. Bihira ang mataba in the 1980s, in the 1970s or 80s. If you see the pictures noon, bihira.
Yung technically obese.
Right. Ngayon kasi ang obese based on the DOST and National Nutrition Council is 40% overweight and obesity. Still low kung considering, let's say, ang mga US and other countries in the Pacific Rim o yung mga Micronesia. Ang laki pa rin ito considering we're a low to middle income countries.
Pero,
But
Doc,
from my recollection, nung naglabasan ng hamburger joints in the 1980s, plus the urbanization and westernization of our culture, plus advanced technology with the coming of Apple and all. So nagkaroon tayo ng increased sitting time. And with the sitting time of 8 hours a day, then we will also have some weight gain. Plus, of course, that will decrease also your mobility. So my explanation, despite the reduction in smoking. Imaginein mo kung may COVID time, wala makakapanigarilyo kasi natatakot ka to have respiratory disease. And then hindi rin ka masyadong makainom. So ang problem, nasa bahay tayo during the pandemic without any regard as to the time. Usually papasok tayo 8 to 5. But 24/7 maaaring gising tayo because wala tayong gagawin. So we watch TV and then nagkaroon ng explosion ng social media,
So Doc,
and then we could not exercise.
actually naunahan mo ako, no? I wanted to ask, so yung context kasi was in the last 10 years or so, maraming namamatay sa ischemic heart diseases, no? In the last few years, parang 70 plus thousand, 80,000 people, nag-90. Tapos in 2020, 105,000 people died from that, no? And then in 2021, in the depths of the pandemic, nag-increase ng almost 50%. 155,000 ang namatay, no? Can you explain? You were starting to explain already, no? Na posible bang ganong kalaki yung increase because of COVID?
Basically, ang nangyari, those kasi that were affected by COVID are those also with non-communicable diseases.
Mm-hmm.
So during the time before the advent of or coming of the vaccines,
Mm-hmm.
either meron ka diabetes and hypertension and may heart disease, you are being pushed right now to develop the severe kind of COVID, pero triggered dyan by your comorbid conditions.
Mm-hmm.
Though yung mga less toxic patients, kung may COVID ka, severe pa rin kasi wala tayong bakuna during that time. But we noticed that those who died during the pandemic, medyo matataba sila at may diabetes and hypertension. That's why yung guidelines ng WHO at CDC,
Mm-hmm.
pinarioritize silang healthcare workers, number one. Then number two, yung may comorbid conditions and senior citizens. Kasi yun ang nakikita nila na namamatay during the pandemic. And that's true. And then ang pinakahuli, yung economic workforce. And come to think of it, ang laki dyan kasi nobody could go to the hospital, and the doctors were not also present. Telemedicine lang eh. Number two, we had difficulty, of course, monitoring these cases because you need face-to-face meeting eh. At ang problem din, imaginein mo, almost 1,000 deaths yan. Pag kinuwenta mo dyan yung deaths per year, maaaring mga 1,000 deaths per day yan. That's equivalent to 2 jumbo jets crashing every day. But you could not see outcry or perhaps complain because these are chronic diseases. In contrast with COVID, one person lang namatay, that's all over the news. So every day, people are dying, or right now, of ischemic heart disease. Because it's so common and chronic, hindi mo na pinapansin. And wala din siya sa radar screen ng government na ito pala nangyayari sa atin ngayon. So people are dying of stroke, cancer, diabetes silently, crying silently. Pero hindi yan nasa news natin. Samantala monitor natin ang COVID cases. Kahit konti ng cases, we are still reporting that on a daily basis. So that is the mindset ng nangyari sa atin.
O nga, what really strikes me, Doc Tony, no? We've had officially 65,000 plus deaths from COVID over 3 years. Mga 44,000 on senior citizens. That's a lot. And I think it's like 1.6% yung death rate. And the global average is 1%. So medyo mataas tayo. And you also have city, you have a province like Cebu, parang 4.8% or 5% ang death rate, ano? Siguro may problema din sa reporting, sa statistics and so on. Pero what's striking is that you have 65,000 COVID deaths officially over 3 years. But in 1 year alone, 2021, more than 250,000 more deaths than the previous year. Yun nga, hindi nga natin alam. Nagulat ba kayo nung lumabas? So this particular report, complete data for 2021 came out only last February 24. Pero 2021 pa lang, you were warning people. May nabasa akong interview with you sa Philippine Collegian na may mga nakatutok tayo sa COVID, but there are other diseases that might be a problem too.
John, because I was on telemedicine, and those patients I saw were my patients talaga. And suddenly namatay sila and they faded. And then may mga newcomers. And then ang napansin ko lang, they would present with hypertension and then increased weight gain kasi makikita mo naman on screen eh. So because of this, wala ka rin chance ma-ECG mo rin siya and makapag-blood test kasi kaya silent kasi siya. You cannot diagnose diabetes by telemedicine. You need the blood test eh. Wala. Cholesterol, ganun din. And then blood pressure is a problem din. Wala rin may alam kung paano iba blood pressure if you're at home. So itong mga problemang ito, ang tingin ko, we need right now to educate the public. Kasi you have a ballooning population and you have less healthcare workers. And then healthcare workers are migrating. And the infrastructures right now may not be present in other areas of the country outside of the National Capital Region, aside from the urban centers. But ganun din ang situation. Kaya mataas sa Cebu, because Cebu is regarded as the second NCR, the National Capital Region, and is the Queen City of the South. And of course, ang daming turista doon. And you can see metropolitan na rin ang dating. So you see this in these areas, particularly in tourist dominated areas, at ito nakikita natin ngayon. So we have huge problem because number one, our healthcare workers are concentrated in the NCR. 50% of the doctors are practicing in the NCR. Number two, we have problems in funding kasi in contrast with other countries in Southeast Asia, covered sila by insurance eh. Ang PhilHealth natin, we have only 57%. We have 50% out of pocket eh. So we are a poor country, and that's why the data from the World Health Organization and Lancet, it's inversely, the GDP of the country is inversely proportional to the incidence of non-communicable diseases. Ibig sabihin ko, mas mahirap kang bansa, mas marami ka non-communicable diseases. So we used to believe that lifestyle diseases are diseases of the affluent or the rich kasi they can afford all of these things eh. But right now, ang non-communicable disease is a disease of the young and the poor. The young because early na sila nakakakain.
Doc,
early na sila nakakakit.
By young,
less than 40.
Less than 40.
Ang edad before ng World Health Organization na kinukonsider namin na delikado, 45 for male and 55 for females. But we see patients right now in the 30s or even in the 20s because yung food na unhealthy ay masarap pero mura. Samantalang yung pagkain na hindi masarap pero healthy, mahal. Let's say fruits and vegetables. So we have problems like this. And then ang smoking din, mura ang sigarilyo in the Philippines, nakakabili ng tingi, and then alcohol. So yan ang nagiging problema. And the lack of check-ups na dapat ma-address ng universal healthcare, hindi pa natin naumpisan kasi it was signed in February of 2019, na-delay because of the pandemic. But the previous, yung mga countries na nauna sa atin, na nag-concentrate on the healthcare, naunahan tayo. That's why in other countries, makita mo maganda ang kanilang healthcare system. So atin fragile and weak yung ating healthcare system, exacerbated by the COVID pandemic. Nabisto natin na hindi pala tayo ready. And then, nung i-implement natin ang UHC, tapos may pera tayo from the sin taxes, nagkaroon naman tayo ng problema in terms of our focus because the whole world and even the Philippines has been focused on COVID alone, forgetting that the statistics will tell us that the COVID pala, hindi pala siya number 1 killer in the country. The highest that it went up, nasa number 3, but right now, it's number 11 and out of the magic 10 in the top killer diseases of the country.
Doc, yung data for 2022, no? So last year, January up to September pa lang. So preliminary data shows that there are some 77,000 deaths attributed to heart disease. If we were to extrapolate this, spread it to the end of the year, we're looking at around a little over 100,000. So 2020, 105,000. 2021, 155,000. 2022, baka bumaba ng 100,000. Does this mean, Doc, that the lifestyle disease crisis is over? Or there's another way of looking at the trend?
Medyo because of the vaccination, nag-reopen ang ating check-up. And we were able to address that kasi back kami sa clinic. And we were able to address that by refill of the medications, laboratory. Kasi nung, if you remember, the major vaccination natin was December of 2021. And then we had Omicron of January. Pero mild na yun eh. Everybody, yung mga doctors na nakabalik na sa clinic. So, nahuli namin ito. But marami pa rin kaming catch up. And I think, underestimated itong figures na to kasi hindi naman ganun yung pagmamonitor natin with rigor nito. If we would sana monitor the heart diseases kahit man lang on a monthly basis, then we would have actually prevented so much death eh. Kaya lang, it's not on the radar screen kasi silent siya. So, hindi nabibigyan ng full attention ito on how to do it. And mostly, ang pag-address din natin, hindi sa preventive side eh. Kasi dumami rin ang nagda-dialysis. So, ang movement ng government is on the downstream, meaning to say, increasean yung dialysis from 90 to 120 to 140. Not that I'm saying it's not as important, but the government should have actually incentivized primary care doctors na learn how to prevent through the check-up eh. Kasi kung a-address natin downstream, let's say sa PhilHealth, eh, yung mga bypass and then yung ating dialysis doon natin i-address, masyadong mahal siya eh. Expensive siya pagka nandun sa chronic diseases. So we need to prevent it by doing some healthcare policies that can help us. So the first thing that I know, the first reason why we fail is ignorance. Hindi alam ng mga tao, mataas ang sugar nila, cholesterol and blood pressure. So kung meron tayong test for COVID, testing and tracing, ba't naman wala tayong test, let's say, for diabetes and of course blood pressure? And when we can do that, ang problema hindi lang natin na-alert. So knowledge is key. And I think ang pwede natin magawa sa health, with due respect lang to our Vice President Sara, ang emphasis kasi on ROTC, I would have expected sana na ma-insert ang preventive health education into the elementary and high school kasi nasa formative years ito eh. So if we can set that up early on, then maturuan sila na ng calorie counter, healthy food plate, exposing the ill effects of smoking and alcohol, then we can avert yung pagdami ng heart diseases and non-communicable diseases.
So it's possible to say na yung level of deaths noong 2021, it's a super crisis. But even at 100,000 deaths, no, it's still a crisis. And it
Is the,
requires a crisis level kind of response.
that's correct. That's correct. Kaya lang kasi it's not heightened up by the media and even mga writers kasi hindi na-expose yung ganong balita eh. Kaya ang tingin ko may problema rin in terms of our government as well as our national leaders. And hindi lang ang problema natin yan locally but the whole world eh. Kasi we were focused on COVID, forgetting na yung statistics pala hindi natin pwedeng pansinin kasi acutely yung namamatay eh. Pero yung non-communicable disease, chronic na siya, pero siya rin na namamatay sa COVID. So, ibig sabihin, you have stable non-communicable diseases, pero pag nag-COVID, namamatay ka rin. Pero ang COVID kasi, kaya nandun siya sa limelight, kasi acutely you will die eh. Ang non-communicable kasi, chronic yung transmissibility, and then may period of stability until magkaroon ka ng COVID. But eventually, these persons will also die not of COVID but because of the course of the illness. But we need to address it kasi right now it's on epidemic scale pero silent siya. So we need a different mindset on how to do that.
Doc, is there a gender bias to heart disease?
Yes, dati male-dominated siya because of the preponderance of smokers sa lalaki and then of alcohol drinking. But ngayon, because of the lifestyle and the presence of other occupation like BPOs, yung mga nagtatrabaho sa gabi, wala nang difference eh. Dominated pa rin by the male, but I would say the split up. Maganda magkaroon ng data sana ng Department of Health. I think the split up hindi 50-50. 70 male and I think 30% ang babae. And I think the babae may be secondary to obesity and diabetes. Kasi mas mataba ang babae kaysa sa lalaki. Because after, according to the DOST, the women develop obesity after the postpartum period. And then pag nag-anak na lang, kasi they usually gain 30 pounds. And then after that, mag-aanak uli. So hindi na sila nakakabawi. And I think that's the number one problem in the Philippines. But ngayon, sa atin, marami ring mga batang babae na nagpapakasal. And then, of course, nagkakasakit sila at an early age. Hindi katulad noon dati, mag-aasawa kapag 30. But ngayon, ang daming nag-aasawa ng 20s pa lang. And this will actually increase the prevalence of obesity in the country. So, the long and short of it, ang male usually triggered by smoking and alcohol plus the metabolic syndrome. But mainly, ang babae is metabolic syndrome with some smokers and, of course, alcohol drinking.
Exercise is preferred. Does it work?
In fact, ang exercise kasi, ang isa diyan dapat in terms of policy, in other countries, no, we were in Hong Kong last a few days ago, 4 days. Yesterday, galing tayo ng Hong Kong. In the flow ang exercise in the flow of their work and in the flow of tourism. You have walk lanes and bike lanes and their infrastructures are good. That's why tayo kasi makikita natin because of the lack of transport. Ngayon nga may transport strike tayo. Wala tayong MRT and all. Kaya nagtatrabaho tayo seated na matagal sa, let's say, sa trabaho. But at the same time, there's also increased sitting time while traveling. So, haba. And then, pag nagutom ka, magda-drive-thru ka. So that also will also contribute to our problems. So, I think, tama yung sinabi mo, yung exercise can be addressed by working as a whole of government approach. Kasi, kailangan yung DPWH, pag nagawa ng kalsada, they have to consider bike lanes and walking lanes plus parks so that people can exercise. Like in the NCR, you can only exercise at the CCP, Luneta, Quezon Memorial, Montalban, UP Diliman. Wala tayong parks in every corner just like in other countries. Plus ang MRT natin, ang train station natin, siguro in these 6 years of the administration, matatapos yan. But ngayon pa lang tayo nag-uumpisa.
Well,
So I think tama yung sinabi mo.
Iloilo has a very nice esplanade, no? That you can, parang 9 kilometers long na yata, pwedeng mag-exercise. Doc, we've had previous conversations before about the coronavirus pandemic response, no? I think it's fair to summarize your position na my hits and my misses, no? What I'd like to ask you is, what did we do successfully in the pandemic response that we can apply to the crisis sa lifestyle diseases?
One is the regularity of the meetings of the government. If we could apply only yung meetings to address the non-communicable diseases with the same rigor and vigilance. If you remember during the peak of the COVID, every 2 weeks, President Duterte would convene the IATF niya and then address that. Then may marching orders. Yun, with regularity. Number 2, meron silang data on churn out by the Department of Health on a daily basis, yung cases, positivity rate, active cases. May game plan malinaw yun yung game plan. Pero execution part ang nagkaroon ng problema doon. But there's a plan. So, and then may policy kaagad sila to fund it. Meron na kaagad silang ng funding dito. Ngayon, ang funding natin dito sa non-communicable diseases, ang hirap nito because you need to provide medicines as well as testing. So, paano natin magagawa yun when the poor cannot even go to the hospital or for a checkup? Ang hirap nito. So, yan ang dapat isipin. So, we need a strategic plan, a vision, because it will hurt us in the near future. Hindi lang, it's hurting us right now, but it will start to balloon in the next few years because the obesity and diabetes and the sitting time plus technology, lalo na with the explosion of social media, meron ng Twitter, may Facebook pa, may Instagram, then you have TikTok, lahat yan will require us to sit down and the lack of exercise plus the unhealthy diet. So ngayon, wala na rin tayong time zone kasi 24/7 gising ka Your boss may actually be there outside of out in the other part of the world. Gising ka rin. So paano mangyayari diyan? So we need to address that as a country on how to prevent it.
Doc, maybe just a couple of questions, and then we can wrap it up, no? Yung credibility ng data, no? The PSA data comes from city and municipal death certificates, no? Which is different from the COVID reporting system. Can we trust the figures?
We can trust the figures, yung death certificates. Kasi sa US dati, when they crafted the Framingham heart study, kung bakit tayo, alam natin na pipredict who will die from heart disease. They examined, let's say, 300,000 death certificates. And then doon nila nalaman who would die of heart diseases. And that's the Framingham heart study na almost 75 years ago. So yun ang nagsasabi na pagka may edad ka, may family history ka, may genetics, naninigarilyo, yan yung risk factors. Nakuha yan sa death certificate. So I would believe the PSA data as accurate compared with the Department of Health. Kasi ngayon, wala namang focus dyan. At saka during the pandemic, yan ang nagiging problema natin. Data mining and all. Kaya nga nagbo-volunteer dyan yung UP at ang COB at saka yung Octa Research Group Sumikat ang Octa Research Group because of the UP professors, sina Professor Guido David, sina Ranjit Rai, sina Dr. Benji Ko, yung private sector, nag-contribute na on how to get the data. Marami na nag-analyze. You have the data from the DOH, but a private sector group ang gumawa niyan. So I believe the PSA group and the Octa Research Group, with due respect to the Department of Health, kasi walang on a regular basis na gumagawa niyan eh.
Speaking of the Department of Health, Doc Tony, my last question, no? There's a lot that needs to be done. Paano yan wala tayong health secretary? Ano ba papel ng Secretary of Health?
I don't understand nga eh, kasi in any leadership, I would say guidelines, dapat meron kang at the helm of the Department of Health that would provide a strategic goal and the vision. And for 8 months, wala pa eh. Wala tayong COVID exit plan, wala tayong plan for the execution of universal healthcare, wala tayong, I would say, a clear plan of action. And we're missing this because even the medical community would like to hear from the health secretary, ano ba yung things na pwede kaming tumulong. So makikita mo maraming vloggers ngayon telling the people, kasi out of their own volunteerism, ginagawa nila yan because they want to help eh. And I think this is the main reason why many health advocates have stepped up to the plate in order to help the government. Makikita mo ngayon, wala masyadong trash talking ngayon eh. Nakita mo ngayon, medyo lahat ngayon worried about the situation eh. Kasi, or else, kung hindi tayo tutulong, wala eh. So, we need to work from the base up right now so that we can actually reduce the burden of cardiovascular diseases. Kasi talagang feel namin as doctors the burden of heart diseases and stroke, cancer, and diabetes. And it has gone out of control. Pag ngayon, hindi lang natin napapansin kasi hindi naman yan na ipe-press con ng Department of Health.
Doc Tony, we'll keep monitoring this silent public health crisis. Dr. Tony Leachon, thank you very much. Your health reform advocacy helps keep the public healthy and the public square open. Thank you.
Thank you very much, John, and thank you to Rappler for this interview. Magandang gabi po.
That's it for us tonight. The next step for engaged citizens is always to take a more active part in rebuilding our democracy. See you in the public square. This is John Nery. Thank you and good night.